Hello, students. We're going to be dealing with Chapter 32 today, which is the process of um, treatment. So we already finished with looking for the setting where the client is going to go, and now we're looking for the actual process of the treatment, which is Chapter 32. And the objectives here are to understand the process of treatment for SUDs and identify the stages of recovery from SUDs, and to outline the specific points during the process of treatment in relationship to the substance addressed in treatment of the substance use disorder. So, in the introduction to treatment process, for most clients, the primary goal of treatment is attainment and maintenance of abstinence, but this may take numerous attempts and failures at the controlled use before sufficient motivation is mobilized. In other words, when a client goes to treatment, the primary goal is going to be to attain abstinence and to maintain it. But it's not uncommon for numerous attempts at treatment to take place. And, sometimes there's failures to control the use before you get enough motivation that you can mobilize a successful treatment experience. In the past decade, the concept of rehabilitation program has emerged as a form of disease management. So before it was, like we talked about free will, or that you should be able to be strong enough, or that you have a weakness. But then research showed that this is a disease process that is taking place. The most important factor in recovery from a psychiatric disorder, including addictions, is the readiness to change. And we already said that unless the person has the motivation to change, the internal motivation, not the external motivation that everybody's imposing upon them to change, success will be difficult. People who seek professional assistance with an SUD have been addicted for 5 to 8 years or misused heavily for 10 to 19 years prior to seeking treatment. So that's a long time for habits and patterns to be ingrained in our brain. So most substance use disorder treatment programs use a combination of group, individual, or family or couples counseling. According to the National Institute on Drug Abuse, group therapy is the most widely used treatment modality in addiction programs today. So some of the methods that they're using that are evidence-based means that it's based in science, or you're able to replicate the experience and show proof that it works or it doesn't work or it's useful. One is motivational interviewing, and it's best if the client's motivated within. And we already talked about that in terms of mandated treatment and everything else. In order for a client to participate in something and to make an actual life change, the motivation, they say, if it comes from within, then you stand a chance in treatment. Also, with cognitive behavioral therapy, the idea here is that the thoughts that the individual sends to themselves through self-talk helps shape an individual's self-concept and how they see others. And in the voucher-based reinforcement treatment aspect, here is where they actually distribute vouchers with a certain number of points or even credit that you can use at a certain store for a period of abstinence. So in other words, if the longer you're abstinent, the more points you get, the more credit that you get so that you can buy things. But it has to be officially documented, like through a urine sample, urine testing, and other criteria that the program sets up. At no point in time is money used. So, research shows that this is effective, but it's effective for a limited time only. And usually it's for a period of 6 months. The most important factor in recovery from a psychiatric addiction disorder is the readiness to change. And I emphasize that, the readiness to change. You can't force somebody to do something if they don't want to. If they're not invested, if they're not ready to make a lifestyle change, then it's going to be very hard to make lifestyle changes. So those persons most likely to continue with an active substance use disorder as they go through life are those who have a concurrent psychiatric or medical problem. In other words, the more complex the situation is, the more difficult it will be for the person to be successful. And so for current steps of recovery, see the textbook page 440. And it gives you a view of the diagram of stages and behaviors and their therapeutic challenges addressed during this time. And looking at the diagram, it starts off with a stage of pre-contemplation, which means that the client's showing these behaviors. The individual is still actively using chemicals and has not thought of stopping the use or of recreational chemicals. Individuals might not see the use of chemicals as a problem. And then therefore, you as the counselor, your job is to teach the client about the effects of drugs on abuse and the risks associated with their use. There goes your psychoactive drug sheets. Help client to build self-esteem and help client identify barriers to recovery. The next stage would be contemplation. Here the individual is still actively using chemicals, but has ambivalence about whether he or she wants to continue. Your job as the counselor is to teach the client about the effects of drugs on abuse and risks associated with their use. Again, the psychoactive sheets, and enhance motivation for change. Be supportive. And the next stage is preparation and determination. Here, the individual has decided to quit in the immediate future. Your job is to enhance motivation for change, help individuals make behavioral plans to support impending change. The next stage is action. Here, the individual has started to try to avoid further chemical use. Your job, identify relapse triggers, help individual recognize symptoms of impending relapse. The last stage is maintenance. The client has made behavior change and continues to work to learn behaviors that will support recovery from chemical use. Your job, to ensure stability of change. You help the individual identify and deal with any personal issues that might be a threat to his or her recovery program. And remember that each step of the way, you're looking at the potential for relapse and trying to clear the pathways there to avoid the relapse pathway. And then ultimately, the termination stage is going to be that the client has made cognitive changes that support abstinence. And that is the goal, right? We said earlier to achieve abstinence and maintain abstinence. So what works in predicting recovery from substance use disorders? Well, working on interpersonal relationships. We know that no man is an island, and so people need each other. And so working on social skills and being other oriented and also taking care of yourself is very important here in order to maintain relationships. And you're going to use cognitive reappraisals. Remember we said we self-talk, we look at what's going on, you talk yourself into it, and then you see, are you doing the right thing? And it also helps you to see, are other people doing the right thing? And it increases your self-esteem. And then you're reviewing demographic variables. You know, you're looking at your environment. Environment is always so important. An environment can include many factors, from your community to your home to your church to your work to your friends. And the severity of the substance use disorder. You need to be realistic here in what you're working with. And the involvement in Alcoholics Anonymous or some other religious groups. Remember, we talked about the importance of spirituality in healing, in the healing process. And the individual expectations and self-evaluation is something that you need to work with your client and yourself to have realistic expectations and forms of what you can use to checkpoints to see if you're achieving things or not achieving things and what would help. And then we have the specific points to address in rehabilitation. One, when you're dealing with alcohol, is the illusion of being in control. You know, I got this, I can handle this, I can do this. And so you need to be working with that area. Narcotics, analgesics, the question of abstinence or opioid agonist therapy. You know, in the next chapter, we'll talk about when medication is useful and not in treatment, in the treatment process. And the central nervous system stimulants, looking at relapse prevention and social support groups is a really important factor here in being successful. And in the area of marijuana, learning alternative coping mechanisms, because we know that the majority of people who were in the research said they started using marijuana to relax, you know, to get stress levels down. And so you learn alternative strategies for coping with life in a positive light. And then hallucinogens, dealing with that. And then when you're dealing with anabolic steroids, it's going to be really important to address the nutritional guidance with a dietitian and looking at food and how you see food and coexisting disorders of body image problems and accepting self and working with self and appreciating self. So that concludes the chapter on the treatment process. Thank you.